So one of the most frequent questions I get asked is this: Dr. Cale, how do I know that neurofeedback is going to change my brain? How do I know it really works? Well, apart from the 1,500 studies that prove that neurofeedback is effective, I thought it'd be useful to show you how we answer that question. I'm going to bring you inside of a couple client sessions from last week. I thought these would be good examples. Not every session looks like this, but it's a good example of how neurofeedback actually shifts brainwave patterns during a training session. So here we have a client, a female who has a busy mind, right? Very, very busy mind. And with that, you see, and that's reflected, by the way, in this blue line, which is alpha wave pattern. Particularly, we see here that we have a difference between the right side and left side, but we see this very strong alpha pattern, which is consistent for her very busy mind. We also see this red line down here. I'm going to make a slight adjustment here so you can see this more, perhaps more clearly without the interference. And we see that we now should see two sets of lines, right? Just blue and red. And you can see how the blue moves much further. When you see the blue is very high, up around 36. We'd like for this to be around, for her, perhaps 12 to 14, 16 would be great. And we can see that during her session, look at this. See how this is this blue line coming down like this is a sign of a busy mind that's quieting, right? It has an added benefit because we see this red line also comes down as well. It is not going to come as far because it doesn't have as far to move. Now I could, I can demonstrate this a little more clearly, perhaps too much so, but if we do this, I get rid of all the other variables, but that you can see that's taking the same thing you just saw, and I'm accentuating this, starting up at 10 or 11, coming down here to around 6. That's remarkable. Why? Because this is beta. High beta is associated with lots of anxiety, fear, pressured thinking, worry about the future, but it has this negative connotation. That's not just about being able to busy. Well, what's on my to-do list? Oh, what if I don't get that done? It's pressured thinking. So we can see not only does the busyness come down, but when the busyness comes down, which is the frequency of thought, anxiety tends to come down. And you can see that demonstrated beautifully in this session. I'm going to show you another example from a week ago. Hang on. So this is a gentleman, a couple years older. We have quite a few clients that are peak performers. They are businessmen, they're attorneys, they're executives wanting to experience more satisfaction and more ease in particular. They've created very successful lives in many ways, but the level of anxiety and the price they pay for that starts to add up. And this would be a good example. This gentleman has a very busy mind, but you can see that during the session, you see this blue line again representing alpha. Alpha, when it's high, very busy mind, but we see how within one session how this comes down, remarkably so. And we can also see how that red line, that same beta that we talked about, which is the negative, more anxious part. And I'm going to try to do this in a way so you can again see it all more succinctly. So now we just have beta. Here, the red, excuse me, and the alpha there in the blue. So anxiety's down, busy mind comes down, anxiety comes down. At the end of the session, this gentleman said, I don't want to get out of the chair. I just want to stay here all day. And that will often happen, not always, but often. Now, keep in mind, this is not going to stick yet, right? We have to keep training in order for the brain to accommodate and accept this as the new norm, so to speak. Now, in part 2 of this series on how do we know that neurofeedback changes the brain, I'm going to give you some examples of the QEEG or the maps that we do with our clients. And you'll see the before and after, what 3 or 6 months of training does to change the brain in a more sustained way, the dramatic changes that occur that help our clients to walk away with just a game changer in their life. Uh, Anxiety that's not there, panic attacks that have disappeared, feeling more satisfaction, sleeping better, not as depressed. Just about any area where the brain struggles, the 1,500 studies now, not all, but mostly support a strong positive result from neurofeedback. It is now level 4 or 5, with 5 being the highest in mental health interventions. Neurofeedback is either 4 or 5 for most conditions. And people are often wondering, well, why that is. Well, this is why it is. When you can begin to change brainwave patterns, because the brain has to change the way it's doing business in order to do what you see here. And it does it with this beautiful and somewhat complex in terms of the technology, but simple in terms of the model, where it gets feedback. And this is a rewarding process that encourages the brain to continue to move toward ease. Well, if you'd like to speak with me personally to learn how this might work for you, your family, you can always set up a personal consult at no cost. You can find me at hometrainyourbrain.com or at capitaldistrictneurofeedback.com. If you're interested, please reach out. I'd look forward to speaking with you. Also look for part 2 in this series where you can see the actual QEEG and how that changes. Take care now.